Oh, Dr. Goldfinger, how nice your private consulting rooms are.
Thank you for saying so, Mrs. Hattersley. This is a real mahogany panelling, you know.
Oh, how lovely! Do you know, I haven't got a shred of private medical insurance, but it really was worth going without my holiday this year in order to have this lovely private consultation instead of seeing you in that terrible old NHS hospital.
Absolutely. And of course the money one makes from one's private practice is all very well, but the real rewards lie in the quality time one is able to spend with one's patients, unhampered by the usual NHS bureaucracy.
It must be like a lovely holiday.
Yes, here in one's private consulting rooms, one is absolutely the master of one's own domain.
Oh, how thrilling! Like a mighty lion.
One doesn't like to flatter oneself.
Surveying one's jungle.
One rather thinks a lion might live in the savannah.
Biting the balls of a monkey, if one jolly well feels like it.
Quite. Now, I'd like you to have some blood tests done at your surgery, Mrs. Hattersley.
Oh dear. Do you know, Dr. Goldfinger, that my GP, Dr. Hairy, actually has wood chip on his consulting room wall?
Wood chip? Good God. This is real mahogany panelling, you know. Did one mention that?
How lovely!
Nevertheless, have these blood tests done there. I shall just write them down for you. Excuse me while one puts on one's monocle.
A monocle! How delightful!
One never wears one's monocle on the NHS. Reading glasses are the order of the day there, one fears.
Oh, how terribly dreary.
Now, you should have these blood tests done on the NHS, but have the results sent to me here at my private consulting rooms. That way, one doesn't have to pay a private fee.
How terribly kind of one, Dr. Goldfinger. One really is like a mighty wildebeest.
Lion.
Oh yes, one meant lion, of course. Full blood count, ESR, renal, thyroid function, and liver function, and copy results to Dr. Goldfinger's private consulting rooms. What? What did you say? Full blood count, ESR. No. After that. Thyroid function. You said something about Dr. Goldfinger. Copy results to Dr. Goldfinger's private consulting rooms. Yes, that was it. Dr. Goldfinger's private consulting rooms. You see what this means? It means that this is a private blood test. Now do you see? Oh, yes. Is it on private form? No. Is the private box ticked? No. So, it is a private test, but he is trying to avoid the patient paying a private fee. So, Dr. Goldfinger, once more our paths cross. Once more you seek to bend the rules, to suit your evil schemes. Once again you attempt to outwit me. Me, Dr. Wittgenstein, the head of the whole biochemistry department. But you shall see who is the outwitter and who's the outwitted. Oh, yes! So, what shall I do then? Send the patient a private invoice, of course. Must I think of everything myself? Okay, right. Now, this next one is from Dr. Underslider, B12 and folate. What? What did you say? B12. B12 and folate. Just as I thought. The forbidden test. So, Dr. Underslider, once again the battle is joined. Once again the game of wits begins. Oh, what a wonderful morning! Oh, what a wonderful day! I've just had a private consultation, and my friends are all green with envy. What's this on the mat? A letter for me. Ooh, I must put on my monocle. Oh, there. That's better. Now, let me see. What have we here? What? 150 bleeding nicker? For a blood test? You get out of the way, Tiddles, you stupid bleeding cat!
The thing is, Mrs. Hattersley, that if you decide to be seen privately, then any tests you have done as an upshot are meant to be private as well.
But Dr. Goldfinger assured me that there wouldn't be any charges.
Well, he really shouldn't have said that. I'm afraid what he told you was really bending the rules.
Oh, but how was I to know? Oh dear. I'm not a rich woman, Dr. Harry. If it wasn't for the hedge fund and the insurance money from when my husband faked his own death, and the Krugerrands in the box under my bed, and the family diamonds in the bank vault, I'd hardly have anything at all.
I see.
And I normally get poor little Tiddles a side of salmon for her birthday with some beluga caviar, but I'm afraid this year she's having to make do with breaded pollock. Poor little thing. I shouldn't be surprised if she were to choke on it. If only you could ring up on my behalf, Dr. Harry. Nobody ever takes notice of a silly old thing like me, but if you were to call, I'm sure it would make such a difference.
Well, Mrs. Hattersley, this is really nothing to do with your medical care.
Oh, but it's been such a shock to me, Dr. Harry. I'm sure it won't have done my heart any good. I don't think I've ever felt so terrible since that time you put me on the wrong tablets.
No, I don't think there's any need to bring that up again.
Well, of course, I don't remember it very often these days, but it was a dreadful experience at the time. Those palpitations, and then the seizures, and then the hair loss.
It was a simple mistake. You had a full written apology.
And then, you know, being certified dead like that.
All right, Mrs. Hattersley, I'll do what I can, but I really can't make any promises.
Oh, you are kind. I do so hate to be a nuisance. You must have more important things to worry about than a silly old thing like me, I'm sure. I'm sure you'd much rather be playing a round of golf or having your buttocks pierced.
No. Look, I'm sorry, Harry, but I'm afraid you're asking the impossible. The money one makes from one's private practice is of no particular interest, of course, but one does have certain obligations towards one's staff and so forth. Wages must be paid, after all. If you really feel so strongly about the matter, you can always pay the invoice yourself. What? Oh, the infernal cheek of that chap. Asking one to waive one's fees. Can you imagine? Wood chip wallpaper? Fellow's an absolute rank outsider.
Does that mean I can have some wages this month?
Shut up and make the coffee.
So, Dr. Harry, once again our paths cross. Once again the fates bring us together.
Actually, I don't think we've ever spoken.
So, Dr. Harry, we meet at last. You, the arch-manipulator of NHS regulations, and I, the enforcer, the guardian of the rules, the Brunhilde, if you will, to your Siegfried, the Ice Maiden preserved in a circle of enchanted fire.
Oh, forget it.
Whose charm can only be broken by... Hello? Hello? Oh, these faulty telephones.
Well, I'll just have to tell her. That's all. I'll just have to tell her straight. That's what good GPs do. They talk things over frankly with their patients. If you talk things over properly with people, that's the best way to get results. Most people are pretty reasonable if you talk things over with them, so that's what I'll do. I'll ring her, and I'll be perfectly open with her. I'll just come right out and tell her. Right. Right, here goes.
Hello?
Mrs. Hattersley?
Oh, is that Dr. Harry?
Look, Mrs. Hattersley, I'm afraid you're just going to have to pay that invoice. I've rung them both. I've rung Dr. Goldfinger and I've rung Dr. Wittgenstein at the lab, and it was no good. They wouldn't take any notice. They were both completely adamant, so I'm afraid you're just going to have to pay. There's nothing I can do about it. I've really done my best, but that's the way the system works. That's all there is to it, so goodbye.
Well, it looks as if I shall just have to pay after all. Come here, Tiddles. Mummy's got something for you.